Hello, welcome to the very first episode of the Ministry of Health Lifeline Podcast. I'm going to be your host, Jolie Tunjere, and this is where we're going to be talking about the Ministry of Health, interventions. We're going to be talking about topics ranging from health promotion, disease prevention, topics on NCDs, and every other thing that the Ministry of Health does. I want to tell you that this is going to be your weekly dose of health information, and every other time we'll be coming here to dissect these topics and make sure that an ordinary Ugandan is able to understand what exactly the ministry is doing. And on the very first episode, I am happy and chanced to be hosting none other than the Ministry of Health Permanent Secretary, Dr. DianaAtwine. And today we are going to be talking about an initiative of government, and Dr. Diana was part of the team that launched this initiative, which is the District Social Service Committees. Doctor, I want to welcome you to the podcast, and I'm happy that you're here. Thank you very much for sparing time.
Thank you so much for inviting me here. And we welcome all of you, the viewers. We started this as a way of bridging the information gap, but also to continue engaging with you so that you are able to know what we are doing. And we want to have constant interaction with you.
Yes.
Today we are here to talk about something very, very special to my heart, and that is social services committees.
What exactly
these
are
committees, this is a program under PDM. I believe every Ugandan in this country knows what PDM is about. Parish Development Model. Under that framework of Parish Development Model, there are a number of pillars under which this program is going to be and continuously to be implemented. And Pillar 4 clearly stipulates the social services at parish levels. While PDM is known for money has been sent to the district, here we are talking about social services at parish level. We came up with a manual and also a very clear strategy on how to implement this. This is to complement the efforts or to make holistic approach to PDM program. Number one, these committees are supposed to be at parish. And we are going to pilot, because really this is a new initiative that we started together with other ministries that work within the same space, like Ministry of Education, Ministry of Local Government, Ministry of Gender, and also partly we'll be working with the Ministry of Water, because they implement also social services at the grassroots. And these committees clearly are supposed to be receiving reports of our foot soldiers that go house to house. For the sake of health, we are starting with 6 districts, and also those districts is where we have put community health extension workers. Those community extension workers are at parish level, 2 of them. Each parish has 2 members. The committees at parish will be reporting to the sub-county social service committees. The social service committees at sub-county will be reporting to the district social service committee. And the district will be reporting to us. The objective of these social service committees are to follow up at finer detail the issues that affect the population at parish level. Here we are talking about education, health, gender, water, and all other aspects of social services and being implemented within the local government. The social services committees at parish level are chaired by LC2. The secretary is parish chief. We want to take advantage and leverage the elaborate structure of government in the lower local governments to ensure that they follow through, they take responsibility. We have also our CHOOS that will be part of that. We have the health assistant who will be presenting the data that will be captured from household. We have equipped our community extension workers to visit household. Our interest holistically is to see the services that reach the people. If they are not reaching the people, we need to know and we need to receive the reports that come through. We want to see how community owns this program. We want to see the local leaders at parish level participate in ensuring that the social services reach the people. We want also to see the increase of transparency. So it is not about money that we are so much interested in as far as PDM is concerned. We are more concerned about services reaching the common person at the village level. So we are leveraging the structure of government in all areas, right from the district to the village. At parish level, LC2 is the chair. Parish chief is the secretary. The representatives of all these agencies, like Ministry of Health, we have our CHOOS and health educators. We have the teacher, the head teacher of the schools within that area, that parish. We have the gender officers at lower levels. We have the civil society representative. We have LC1s in that meeting. So now when they come to meet, and we're proposing that they are going to meet every month, the agenda of that meeting is to evaluate how the social services are being implemented in the parish. For example, under health, we have our community extension workers whom we have equipped properly. We have equipped them with the tablets that can help them to collect all the data at household. We have equipped them with glucometer so that when they go to the community, when they're at household, they can test diabetes. We have been able to give them blood pressure machine so that at household we don't miss anybody who has high blood pressure and does not know, because many of our people don't go for checkup.
That's true.
We want to interest ourselves on sanitation, both at household but also in the environment. Now that we are going to embed national cleaning days, we want to see how the waste, the cleanliness at household but also in the environment. We want also to see that our mothers, all of them, do not miss antenatal attendance. These are very, very important indicators of health. Our children are going to be assessed in terms of nutritional status. The CHOOS have been trained fully to assess the nutritional status of our children at household. So they will be measuring their mid-arm, whatever circumference, to see whether they have some level of malnutrition. We want to see that the children, all of our children are immunized. All that data at household will be captured because we have a digital tool we have put on these tablets that the community extension workers will be collecting. Now, the education will be giving us information. We are still working with them to make sure that they give us the indicators that we are going to track. For example, how many children have dropped out of school. We want to also to report on the hygiene and sanitation status of our schools and our facilities. We want also to see that this issue, this painful issue of open defecation In some districts, I was amazed.
Yeah.
Recently, when I went to Mayuge, and I was told that entire 6 parishes, they do a lot of open defecation because of beliefs, especially in the islands. So we can't develop, we can't defeat diseases if we continue with our backward beliefs. So once we get all this information in this report, then it is presented at social service committee at parish level. Once that report is presented, the recommendations must be made based on what has, if that particular village, there is a common disease that is occurring, maybe malaria, our in-charge in that facility is also a member there. That person will be able to tell us that, this place has a lot of malaria. And the community in that area must be mobilized. So the social service committees will be able to go back and say, this village, we are seeing many children with diarrhea. Then we send our educators in that village, in those homesteads, and they continue to educate them. They bring back the report. If people don't have latrines, the leaders, the LC2, the LC1 representing the villages that are under that parish, the parish chief must ensure that if the recommendation is to make sure that 100% latrine coverage, then it is them to follow up to make sure that that is done. And continue to report. But as they are reporting, they are also mobilizing the community to embrace the behavior change. These social service committees cannot work in isolation, but also there is another pillar of mindset change under PDM. We want to see that two to go hand in hand, because even the mindset change can help us on behavior change. HIV, TB, malaria reduction, non-communicable diseases at community level, the issues of hygiene and sanitation, the issues of immunization, the issues of family planning, the issue of mental health, because we are seeing even in some communities that they are using a lot of drugs, a certain community, especially in urban. How do we deal with that kind of group? So the area in that area, we want to see the leaders mobilize the community, make sure that these programs we are doing are owned by the community. It will increase transparency, because once these committees meet, we are not just talking about health or gender, with teenage pregnancy, for example. Under teenage and under gender, we want to see the CBOs, CDOs, the development officers, make sure that they mobilize the community, the elderly. The good thing is that even those social service committees at parish, they are well represented by special groups. We have a representation of women, of youth, of those that have disabilities. They are part of those social service committees to bring their concern at that level. And if there is any recommendation, for example, teenage pregnancy, then the women, the youth are mobilized in that community to be talked to, so that we address the real issue that are causing people to drop out, that is causing the children, girls to get marriage and teenage pregnancy, so that really at the end of the day, at that level of parish, we are able to address these issues. Now, that has a multiplier effect, because the community, the leaders, the representation of these special groups will all be in this meeting and agree to work on the report, will agree to work on recommendations. Now, the things that they cannot handle, because there will always be something that they cannot handle. For example, at parish level, they may not be able to have a well or a borehole or a school or a facility, or maybe a facility is there, but they have a certain complaint, or in this particular area it is an island and there are certain special issues that need to be addressed, those issues are escalated to sub-county social service committee. All the parishes under that sub-county will bring their reports to the sub-county chief. Sub-county chief is the secretary of the sub-county social service committee. And the LC3 is the chair of that social service committee. Why are we really emphasizing this? We want to see political wing and technical wing merge and work together. We cannot change the mindset of the people without getting the details of the technical people getting involved. We can't change the mindset of the people or implement effectively without the political leaders getting involved. And because they represent the people in the community, we want them to be part of this solution, because that's what entails community ownership and involvement.
That brings me to the question of how will accountability be ensured, because we understand that these committees are going to be working in the structure of the districts. That is a bottom-up village, parish, sub-county. So how will government ensure that these committees are really working? Because we understand that, yes, accountability has been a problem. So how will government,
it is true, accountability at parish, sub-county, district has not been very easy. But what will make the difference in social service committees is that we have entire representation of everyone in that committee. And we want them to demand accountability. Accountability for results, accountability for resources that have come out of the parish. Accountability for implementation. Who is supposed to do what? Follow up. If it means taking the entire group of the committee to go to a certain village within that parish to see where things are not okay, please go there. Because it is one thing just to sit and talk, but also it is one thing to go and witness what has been done. That is what accountability is all about. So this issue of accountability is really a serious issue. Because even now I have started seeing some people who took PDM money. some people took, So, even here in social service committees, if our children are not immunized in that village, the first person who will be accountable is LC1 in that village, who sits on this social service committee of the sub-county. What have you done for this village? Why are we still having 0-dose children in your village? Why are we still having... I was amazed when I was in my village. They told me, even LC3s don't have latrines. So in that meeting, then if you are leader, surely, and you are chairing the social service committee and you do not, then it will shame you. So by way of bringing out this information, it will cause people to be accountable and to hold each other accountable, and that's how we are going to foster more accountability. That brings me to the issue of, you talked about how these are going to help the ministry, for example, Ministry of Health, go down to the grassroots, and then how does it speak to the greater vision of the Ministry of Health, and how these committees are going to support that bigger vision? Absolutely. I am convinced, beyond reasonable doubt, that if we implement social service committees and their function in our districts, in our sub-counties, in our parish level, first of all, it will bring the whole critical mass of the people that will be involved in and they take care of their health in their hands. They will not start saying, the government etuyambe. Government tetuwadde eddagala. Why are you falling sick to come? And then you expect government to give you medicine. Ekiddukano. N'olwala ekiddukano. The government nyambe kubanga nina ekiddukano. Because you have eaten something. Which I'm not going to talk about.
You can't even talk about it.
But you see, these are things that we really need to be serious about. If our vision, our national vision, stipulates clearly that we want to get to middle income, we want to increase tenfold growth.
Yes.
How are you going to have tenfold growth when you are still having people who are having diarrhea and coming to facilities? All our money is going to buy medicines of diarrhea and HIV and malaria and all those things. Why don't we get to a level where everyone feels that we are part of this vision, we are part of this greater vision that we need to see people take responsibility. Number one, if we want to have, even Ministry of Health, our vision is to have a productive population, a healthy and productive population. How is it going to be possible when people are sick? So, number one is to prevent. One of the objectives, very, very, very strong objective of these social service committees is to prevent diseases, to promote health. When we go at parish level, we go to the village level, we go to household level, we ensure that households make sure that they have hygiene behavior, good sanitation. If we make sure that all our children at every household in that village are immunized, if our children come to our household and they check your sugar, they check your pressure, they pick all these people who have pressure, they link them to care so that we don't come back very late with kidney disease or heart failure because of hypertension or diabetes. That way you are contributing to a well-developed country. If we reduce on that, I can assure you, dear Ugandans listening to me, if we do that at village level, at parish level, and we prevent diseases at that level, you'll be amazed that we'll not be talking about, upgrade this one hospital. People are obsessed with hospital. Expansion, one year hospital, as if it is really a style that, everyone is obsessed with hospitals.
Treatment-centered approach.
Yes, upgrade this one. Health center to upgrade, health center to upgrade. Because for them, they are looking at output as the way to go. Yes. No, we don't want that. Actually, we want some of those facilities to close. Maybe they can be turned into recreation centers.
That is
okay, because we want really, really a population that is healthy. Women are delivering. Ugandans are really, really, really fertile. My goodness, Uganda, you just amaze me. Fertility of you women. So those facilities, health centers, they can continue. They deliver women, but at least we don't have malaria there.
Yes.
We don't have diarrhea, we don't have cholera, we don't have HIV. Those ones can be dealt with at that level. We make sure that we avoid school dropout. Our children, our young people study and they become the future president. We want every girl, every boy who is born to go through that. We have UPE, we have education system that is well structured to support every Ugandan child. We don't want to hear children in the villages dropping out of schools. We don't want to hear gender issues that break homes. And so that's why really at that level, because if someone will ask me, so for you health, why are you concerned about gender? My friend, if gender has issues, if households have issues, if the man is beating a wife, they will not produce food. Children are going to have malnutrition. They will not go to school. They will not be immunized. Ultimately they will end up in our facility.
In the hospital.
So we are the recipients. So that's why we really want to get to the root cause at that lower level. And we make sure that these committees are functional. They're able to give us the mileage that we want. And because of that, we do believe if they are implemented well, we are going to see Uganda develop. We want to achieve our vision.
You actually are saying that if this initiative is well implemented, followed up, accounted for, is going to boost our efforts.
Yes, we want
disease prevention, to make sure that everybody is accountable for their health and they know.
It is everyone's responsibility for our health. But some people may not know. That's why now we have started this discussion. We shall be coming here every week. We provide you with information. Please reach out to us. Tell us the areas that you want us to discuss. We shall discuss hepatitis, we shall discuss hypertension, we shall discuss STDs, we shall discuss mental health, we shall discuss maternal health, we shall discuss malnutrition, we shall discuss everything. Tell us what is your priority, what is your pressing need that you want to know. And that's why we started this. But we want to go with you. It's not just providing you with information.
Bombarding them with
but we want you to be part of the solution. You, the Ugandan who is listening to me, you can only contribute to your country meaningfully if you are healthy. You can only contribute to your country if you understand that a bigger vision is to develop our country. To develop our country, we must be healthy. To be healthy, we must take personal responsibility with ourselves, with our environment, with our homes where we are.
And I understand this initiative was launched in Mayuge and Namuto.
Yes.
Is it going to be rolled out across the country? Should other districts also get ready to, or it was partially launched and also it is now moving to different districts?
No, we launched, I launched this in Namutumba and Mayuge. We are starting with 6 districts, Namutumba, Mayuge, Omoro, Ngora, Nakasongola, Chotera, and Dubiris. So each region we picked the districts. The selection was based on 2 things. One, where they had challenges of really bad indicators. In some areas really they had bad indicators, and we wanted to see how quickly we can reverse those indicators. But in some districts, it was proactiveness of the leadership that when we launched the Choose, they were very active. They have very good leadership, and they can really embrace this quickly. And so we had to look at governance, but also challenges of indicators, and that's how we selected those. So we shall be implementing this together with the Ministry of Education, Ministry of Gender, Ministry of Local Government, and Water. We want really to work together as a whole of government. We want to see a whole of government approach to some of these programs, because PDM is really a great program, but we need to be comprehensive. It's not just money that is given to people, but we want to see also the social service at parish level reach the people. They participate, they become part of the solution, they follow up, they are mobilized, and they are able to help us, even to report.
Oh, yes.
Some of the things that cannot be done at parish can be escalated to sub-county. Things that cannot be implemented at sub-county can be escalated to the district.
Oh, yes.
At the district, if things cannot be done, can be escalated to the national level. And that's why we really want that whole structure to be fully functional. Because if there is breakage in between, then we will not be able to get to a full whole of government, but also full chain of implementation.
Yes. Are they going to be using the PDM structure, district structure, for example, in terms of reporting? If, say, for example, information is got from the truth, what is going to be the structure? How is it going to be like?
The structure, first of all, at parish level, I've talked about the members that are supposed to be there. The LC2 is the chair, the parish chief. Every parish in Uganda has got a parish chief, but they have not been really doing
enough.
Now, those committees, each parish. Now, in each sub-county, you have a number of parishes. So each parish will have those social committees that are able to follow up, but they will be reporting to the sub-county chief and LC3. LC3 is the chair at a
sub-county level.
And sub-county chief is the secretary. Then the other members, women, people with disability, our in-charge, our health educator or health educators, our the head teacher, the head teacher in that sub-county. The gender officers in that sub-county, they are all members there.
Oh, yeah.
So then they report, the sub-county chief would be preparing reports and submit, and they are supposed to meet monthly.
Oh, yes.
They report
that
to
the
district.
County level?
Yes, they report to the sub-county, to the district. The district RDC is the chair of the District Social Service Committee. COW is the secretary. DHO is a member. DEO is a member. The CDO is a member. And the representative of those special groups. Even we left a gap there. We left one position that if they can pick any influential person, either religious
from
person, the community, they feel that is a very good influencer. At all levels, the district, sub-county, and parish. At parish, even civil society is represented. Civil society, even at sub-county, civil society is represented. Even religious leaders, if they feel that in that locality, this particular imam is more influential to this community, that person can be brought and co-opted on those social service committees. Because we want really proper linkage from the government programs to the community, and the community back to these government programs.
Okay. That is very, very understandable. Thank you so much, PS, and I would like you to take us through your parting shots. What do you think is something you can finally conclude with on this interview?
Ladies and gentlemen, I want to welcome you to this podcast program that we have started. We have started with a very, very critical backbone of our society. And that is social services. Everybody wants social services to reach him or her. We are calling upon you to embrace this program when it comes to you. Do not leave it to government, because there is no government without her people. This country only prides in you because you are there. But we want you to be healthy. We want to be participatory in this program. Secondly, we want to call upon you to dream with us, to dream with the Ministry of Health. that these social service committees will be a transformative engine under PDM to make sure that the services reach the people, but also that people have a platform to air out their concerns.
Oh, yes.
And also own the process. Number 3, we are calling upon broader government entities, Ministry of Local Government, Ministry of Gender, Ministry of Education, to embrace, to work with us to make sure that these social service committees take root. I know that many people are saying, the budget. Those are things I keep on hearing about. Money. Moment we started, the budget. Ladies and gentlemen.
Actually, on that very note is why I want
if we are going to wait for money for everything, even just to come and clean our compound, are we doing justice to our country? This program is for everyone. That's why we are talking about village. Everyone has a village.
Oh, yeah.
What do you need? You need per diem to come and sit in those meetings. You want a per diem to listen. You want per diem to take action on your neighbor who is dropping the rubbish all over the place. Be the change you want all of us to be. So the change starts with you. Your life is your responsibility. Please take care of your life. Thank you.
Thank you so much, PS. And the very last one that I didn't. Is it going to introduce new people into the system, into the district?
No, we are using government structure.
Oh, yes.
All those people, even LC 1, LC 2, they are there.
All of them are government structures.
Women representative, even they went and campaigned and got voted. People with disability got voted. Youth got voted. So, those people who voted for you in the parish, in the village, you have the duty to represent their interests.
Okay.
Make sure you attend. Don't wait for per diem and allowance and sitting allowance, because right now we do not have any additional resources to implement social service committee. But I do believe with all my heart that provided our mindset, our mental faculty is set to do something without tagging with money, this program can succeed. We are not introducing any new structure. We're not introducing any. We are just using the people who are in the community.
Oh, yes.
Yes.
Thank you so much. Thank you very much. And today being our very first episode, I want to thank everybody. We ask you, this program is going to be aired on the Ministry of Health YouTube and all the social media channels. We ask for your feedback. In case of anything you want us to talk about, we'll be very glad to listen to you, to hear from you, so that you contribute to the development of your community, yourself as a person, and you'll be able to get all the health information on this podcast. I've been your host, Jolie Tuonjere, and the next time I'm going to be here also talking about another health engaging topic. Thank you so much.